Well, a physiatrist is a physician that specializes in this field of physical medicine and rehabilitation. And basically what we do a lot of different things, and there's a lot of different niches depending on what a physiatrist decides to specialize in, but we basically deal with nerves and muscles and a little bit of bone. So in this context, in an orthopedic group, we do non-surgical care of anything orthopedic. I happen to specialize more in the spine, so I deal with neck pain, back pain, pinched nerves, that kind of stuff. I do nerve tests to diagnose nerve issues, that kind of stuff. But there are some physiatrists who do spinal cord injuries, strokes, brain injuries. So really anything that affects the nerves or muscle and bone, those are the conditions that we treat. Probably a third of the time I get the really acute injuries, meaning it just happened maybe a week up to a month ago, whether it be from a car accident or a lifting injury, or something happened over the weekend, or I just woke up with this pain. And those tend to be younger people, just because when you're younger, the discs are a little bit more hydrated and you're at a higher risk of herniating a disc. And then I have a third of the patients who come in with kind of long-term, achy, it's been going on for 20 years, 30 years, and now it's getting to a point where I want to do something about it. And then the other third's kind of a mishmash of a lot of different things where, sometimes I get patients who've seen multiple specialists and no one can figure out what's going on, or, I get, because I'm female, I also get a lot of female patients, especially those who just had kids, or maybe they're pregnant and now things are kind of shifting in that pelvis and back, hip area. And so, I get a pretty nice mix of different kinds of patients. There's only 4 reasons to have spine surgery, and that's what I usually tell my patients. So if you're having numbness or weakness to a point where you can't walk or feel anything, if you're having bowel or bladder incontinence to a point where you can't feel yourself go to the bathroom, then those are emergencies. You need to go straight to the ER and get the surgery done. The only other reason is if the pain is uncontrolled, despite trying things like physical therapy, injection, medication, everything but surgery, and nothing's stopping the pain and you can't live like this anymore. That would be the only other reason to do spine surgery. Besides surgery, there's medication, physical therapy, injections, and then some people can try things like chiropractic or acupuncture. Really, the first visit is spent kind of listening to where the pain is or whatever symptoms they're having, numbness, tingling, that kind of stuff. We do a physical exam really based on what they're telling me. So if they're coming in fresh with new pain, then most of the time what we do is we start off with an x-ray, make sure there's nothing terrible going on, like a broken bone or dislocation, stuff like that. And we look for more subtle things like, are they a little bit weak and they don't realize it, or can they really feel me touching them? Is there numbness that they don't really know that they have? So I try to figure out, okay, what's causing the pain and what can we do about it?